Hi everyone, welcome back to another hysterectomy vlog. So I just got off the phone with someone from my surgeon's office, and she gave me the pre-op instructions and stuff like that. Confirmed that I will be staying there overnight. Um, the thing is, I need to be there at 7:20 in the morning, which is very early. Even for me, like I try and get up every morning pretty early, like at 6. Um and it's gonna take like an hour or so to get there, so I'll need to get up pretty early and have a ride there and back and stuff. So I'm gonna try and figure out what I'm wanting to bring. Um because she said I can bring my phone, which is nice. Thinking about bringing a book. I have Where the Crawdads Sing, which I've shown in the last vlog that I did. But I also got the Hunger Games trilogy that was gifted to me, so I've been wanting to read those books. I miss the teen dystopian genre that has since died out, unfortunately. But so I'm wanting to read those too, but I don't know if I want to bring that one to the hospital. I mean, the Hunger Games book is smaller than Where the Crawdads Sing, so I think I might do that. Also, I apologize if you can hear the TV in the background. We got Blue's Clues on here, so. But, yeah, so I will keep you updated as to what I'm bringing. And my surgery's in 2 days now. So I've been going back and forth between feeling nervous and feeling okay with it. So I don't know, it's been a bit of a mixed feeling, but yeah. So today is one day before my surgery. I'm having anxiety. But I'm reminding myself that this is necessary. All the stuff that I've said before in the previous hysterectomy vlogs. But yeah, it's nerve-wracking. I'm worried about like complications and stuff like that, but I literally have the best surgeon in my province to do it. And I called in yesterday because I had a question about like bringing my medications and stuff like that. And while I was waiting to leave a message, the automated message that I was listening to, they had said to not leave any messages regarding surgery dates because you'll be contacted in 4 to 10 months from when you send your papers in. The papers that I had to fill out in the first vlog that I did. I got in 1 month. One. Maybe not even. It was really soon. So clearly my case is a top priority, but yeah, so I'm going to shower tonight. I'm going to figure out what I'm going to bring. I already have what I want to wear. And Garrus is interrupting me. Yeah, I don't know if I'll check in again later today or if I'll just wait until tomorrow. But yeah, so that's where I'm at right now. So woke up from surgery probably about a half hour ago. Not gonna lie, I'm in a lot of pain right now. They're doing everything they can though to make sure they can help me. This is probably one of the hardest things I've had to do, aside from giving birth, of course, but so I'll be staying here tonight and going home somewhere around noon tomorrow.
I have to deal with a catheter all night, which isn't fun. Yeah, it's not fun, but I know in the long run it's gonna help. I'm still glad I did it.
So today is post-op day 3. I'm still not feeling great. I mean, I'm doing okay. Better than what I was when I was still in the hospital there. I didn't get out of the hospital until like I think it was about 5 o'clock in the evening. There were some problems there. I've been having a hard time getting comfortable because I'm supposed to be laying down and like resting a bit more with walking every once in a while as well. Just really listening to my body with that. But it's more comfortable for like my incisions and my abdomen if I'm laying down. But I get a lot of muscle tension and pain in my neck and shoulders. And so if I'm like laying down a lot, it really hurts. And I have a cane and a walker that we brought. And I haven't really been using them much because my shoulders have been hurting so bad, which sucks because we could have packed a lot more things if we hadn't brought the walker. The cane was already in my purse, so that's not a big deal, but the walker, wasn't necessarily needed, but it's better to have it not needed, I guess, but it's still frustrating. So yeah, I've been trying to do a little bit of walking and give my body a break from laying down, but sitting up hurts too. It's a mess. It's hard to get comfortable, like I said. Yeah, that whole day that I spent in the hospital was just absolutely awful. I don't think I mentioned it before, but my legs were they were really heavy from the anesthesia. Like they felt really heavy. And one of the nurses had said, that's not a normal reaction to anesthesia. Of course it's not. And I could bend them a little bit. I could lift them up a little bit, but then I just couldn't. Like my muscles in my legs actually started to like shake because I was trying so hard, and I just couldn't do it. So that wasn't fun. That lasted for like the rest of the day, basically. The rest of the day after I woke up from my surgery. There were some problems with my catheter that I had in. It wasn't draining properly at one point. One of my nurses, she adjusted the catheter and it started draining 700 milliliters that had just been stuck in there, not coming out. And that's part of why I was in so much pain. So yeah, it wasn't fun. But at one point, the first time we noticed that there was some problems with my catheter, one of the nurses said, "It's like, okay, do you think you could stand up? Like, if I help like move your legs and stuff, do you think you could stand up and maybe that'll help because gravity does its thing or whatever, right?" And so I said, maybe. And I was willing to give it a try, and she helped me stand up. She moved my legs to the side of the bed and helped me up and stuff. And then after that, it started to slowly get better. And then I had stood up again for I think the same reason. A different time, like a few hours later. And then it was easier that time, and then over time it just got better. But I have my post-op appointment on the 5th of May. Today is the 30th of April. So that's just going to be a phone call. yeah, so I guess I'll discuss more about what was kind of going on after that appointment because I'll have more information then. But yeah. So today is post op day 5. Um, I woke up this morning very slowly to a phone call from my specialist's office, their nurse that they have there, their nurse's line. And she was just checking in and seeing how I was doing, and I brought up the fact that the incision around my belly button has been hurting. It kept me up a good portion of the night, and I had to take one of the I'm sorry, I'm still waking up. Opioid slash narcotic. I'm not sure what the difference is, but one of those medications. Well, one of those pills. I'm only prescribed one of them, not the actual medications. But anyway, I had to take one of those last night because of it, as it was just impossible to get comfortable. But yeah, she was saying that like if it gets worse or if it doesn't get any better, then to give them a call. And I have my post-op appointment in 2 days, so I think it's on the 5th. It's the 2nd today. 3, 4, 5, 6, 7. No, that's in 5 days. I don't know what I was thinking. I guess I was thinking because it's supposed to be for a week after your surgery, but because of scheduling, I'm not sure. I'm tired. But yeah, so that's been a problem. It hurts a lot to move, but there's no like bleeding or swelling or anything around the incision site, so that's a good sign. I feel like I had this problem with my last surgery as well, and I don't remember what the cause of it was. I think it was probably just doing too much, like going too fast kind of thing. But yeah, I don't know. So anyways, I will check in later. So I just got off the phone with my specialist, and there was there was a bit of a confusion because one thing I don't think I mentioned earlier was that like I was told that there was endometriosis that grew back in a few different places, but that like it wasn't much, it was just superficial, all that. And that had me concerned because with my special case, that's not supposed to happen. I was worried and kind of confused because like, well, if it's not supposed to, why what is going on here, what's going on with my body? But turns out one of the nurses accidentally got my case mixed up with another patient's case, so there was actually no regrowth. So that was nice. Happy about that. He said the pathology for my uterus has not come back yet, so I'm gonna have a phone appointment with him in about 6 weeks, but I do need to have a doctor do a pelvic exam to make sure the vaginal incision is healing well and it's all good. And then when they get the pathology back, if they do find something, they'll call me sooner. But otherwise, it's just waiting for that 6 weeks, that 6 week mark. And then I may have a bladder infection. It's pretty common after hysterectomy, apparently. So he's getting some lab work sent off, so I can get that done. And hopefully that's not the case. But yeah, I think that's about it. And also, I'm sorry if I'm speaking kind of sluggish. I'm tired. I just woke up not too long ago for the phone call. So So today is post-op day 9, I think. Yeah, that sounds right. Okay. So, post-op day 9. I took the steri strips off on day 7 after I showered, which I probably waited too long to do it after I showered because I wanted them to dry first, but then my husband pointed out that it'd probably be easier if they were a little bit wet. So, but it was kind of painful. So, I do want to show the healing progress that that I've been having. So if you do not want to see that, skip to this time, and you won't have to watch it. But for those of you who are curious, I don't think YouTube's gonna flag me for it or anything. But I'm also going to insert a picture somewhere on the screen of like when I was still in the hospital that I took. And then we can kind of compare. I mean, it's kind of hard to compare because the steri strips were on covering it up. But okay, so this is what they look like now. The belly button one hurts the most, along with this one here. You can still see the tape. It's a little annoying. This one's looking pretty good. There's still some of the iodine there that I couldn't get off when I showered. And this one, you can see some of the sutures there, but otherwise, feeling good. So I was just thinking about ending the vlog, but I wanted to get a little bit more footage, so here it is. Today is post-op day 13, and I'm trying not to kind of kick myself because yesterday I figured, like, okay, I want to try and move a little bit more, so I had found like this video on YouTube here that it was like gentle yoga for abdominal surgery recovery for weeks like 1 to 3. And I watched it previously and thought that, like, okay, this would be a really good place to start. It was not. Since then, my pain has been really, really bad. I've been trying to contact my one of the nurses that works at the clinic that my specialist is at, who did this surgery, and we've kind of just been playing phone tag, which is not fun. But now you might be wondering why I did a video instead of like going to physiotherapy or something like that and just like waiting for that kind of thing. But like, for some stupid reason, because I'm on disability, and the government decides to not fully cover something like physio for some reason, which I don't understand whatsoever. Because like that's literally something that'll help somebody get up on their feet again and off of disability. But they don't make it really that affordable, and they don't give you enough money to begin with. So yeah, it's frustrating. So that's why, like, because I simply can't afford physio. So I just have to kind of guess and figure it out. So that's why I did that. And yeah, I've been paying for it. I've been taking the opioids again and using my heating pad. I might have to start sleeping out here on the couch again. The video, it was so gentle. Like, I'm really surprised that it caused so much issues. I was like, I genuinely thought it would be okay. So I got to the point last night where like I was contemplating going to the hospital
And so I called the nurse's line, um, and talked to a nurse there. She asked me a bunch of questions and stuff, and I didn't end up going because with my case of endometriosis, or technically not, if you're curious about what that means, that I have endometriosis, but I technically don't. I have a video dedicated to explaining that, so I will link it below and up probably, if I remember. Um, but with my case, my pelvic floor spasms are really bad, and it can cause absolutely excruciating pain, especially if I'm like stressed or like whatever, right? Or with activity. And I did know that that was something that was going on. I could feel it, but I know it's like, okay, well, I am recovering from surgery though. Like normally, I wouldn't even consider going to the ER for my pain because it's not helpful. All they do is give me opioids and then send me home kind of deal, because there's nothing else they really can do. Um, so you know, but because I'm recovering from surgery, I was genuinely considering it. But it was like 2 a.m. I was like, okay, well, I don't want to go and like freak people out if it's not even needed. Like if it's just like, oh, okay, no, you're fine. I don't want to do that. Um, and so yeah, I'm gonna try calling um, my doctor's nurse again and try and get some advice there. So it's now the next day since the last clip you saw. I did end up going to the emergency room, because one of the things that I was told was that if I throw up, then that would be a sign for me to call 911. I started feeling like I was going to, so I just decided, I don't want to wait until after I do throw up. I just want to like get there as soon as possible. So, I mean, luckily everything is fine. So there are a few other reasons why I could have thrown up, but they gave me some paperwork for an outpatient ultrasound just to make sure there's no like fluid in that area. Hopefully things start to get better.
So it's been a while. But I just had a phone call with my doctor today about the results, because I had, after I went to the ER, I had the outpatient ultrasound booked, and I had that done yesterday, and I just talked to my doctor today, and he said everything looks good except I have a cyst on my ovary from ovulation. Apparently that's a pretty common complication, but I should start to see like my pain and like other symptoms and stuff like that getting better. And today's Tuesday, and he said if by Friday things don't feel better and things like haven't gotten better, then we'll have to figure something out. Go from there. He didn't specify like what would have to happen, but yeah. So that's the thing. But yeah, we're planning on heading home either tomorrow or the next day. But anyways, I think that is where I will leave this video. I will update you guys on the whole cyst situation when I know more. I'm not sure if I'll do a whole other like vlog about it. Probably not. It'll probably be more like sit down video. Unless I decide to vlog the trip going back. I mean, I kind of don't think so. I don't think I will. But anyway. So yeah, that's it for this video, and I hope to see you on my next one. Bye.